function of our brain. This one right here, I share this with you because in our office, the youngest patient we've ever worked on, and we've worked on many patients this old, was a day old. 1 day old. Now many people would say, you should never touch somebody a day old. That's ridiculous to do that. Well, here's what I'll tell you. They have a spine, they have a nervous system, and movement drives proper brain function. Mechanoreception or movement drives proper brain function. And sometimes the birth process can be smooth and easy where there's no problems, no difficulties. But sometimes the birth process can have a lot of stress and trauma where there's pulling and twisting and turning of the baby's head. And sometimes that's necessary to save the baby and to save the mom. But movement, again, movement drives proper brain function. If they've had a stressful birth or even something called in-uterine constraint, where they were positioned in a breech position sideways instead of head down, and if their head was turned, what will happen is that you can bind up the joints in their body, especially along the upper part of their neck. And if that area isn't moving properly, if it's not aligned properly, then it's going to lose stimulation to the brain. So look at this right here. This right here says, a child's first movements clearly have emotional connotations. Remember that movement pleasure pathways, that movement emotion pathways? When you walk, when you move, you stimulate your brain, you feel happier. Movement has emotional connotations. This is what this research is showing. The sensory receptors that signal movement are directly connected to the part of the brain that generates emotion. So all the sensory receptors for movement, the mechanoreceptors throughout your body, are directly connected to the area of your brain that controls your emotions. Even when kids are given stimulation in all other modalities, so neurologically you're looking at visual, so the eyes, the sense of sight, auditory, hearing, taste, if they are deprived of movement and touch stimulation, they get messed up neurologically. Neurologically, their brain doesn't develop properly. It says right here, 65% of neural development, 65% of neural brain and nervous system development occurs in the first year of life. If you do not properly receive information from the environment, your development is impaired. Your reality is distorted and diminished, and you grow up with a distorted view of yourself and your world. This is from this Psychology Today in 1993. I moved, therefore I am. So if we're not getting proper motion, we're not driving brain function. If there's a stress from birth process, it's not, you're going to have their joints are going to be locked up and not moving, not aligned properly, and they lose stimulation. Every single child should get checked to make sure they're moving properly. And I want you to know the adjustment that we do for an infant is totally different than the adjustment that we do for an adult. The adjustment we do for an infant would be like the pressure that we put on your eye with your eyelid closed. That's the amount of pressure. But the key is we have to know, we have to feel what areas are not moving. We have to know where we need to get it moving. That's the key. So for adults, it might be more of a manual adjustment. For infants, it's very, very different. It's very gentle. Now, look at this right here. An American doctor of osteopathy, Viola Freeman, studied 1,500 babies during the first 5 days of birth and found that 90% of the babies involved had suffered birth trauma and strain through the neck and cranial areas, with 10% suffering severe trauma. 90% of the 1,500 babies that she looked at had trauma from the birth process. Now, anytime you have trauma, and I'm going to talk about this in the next slide, is that your body starts to put down scar tissue adhesions in that area where you have trauma. We've all felt this because we've all felt in our shoulders, we felt the muscles, we get big, sometimes we can get big knots in different muscles. Some people call them trigger points. But what those trigger points are is that scar tissue adhesions that form in the fascia in the muscles that also form in the joints in our spine, the ligaments, the tendons, and the disc all around your spine. And those form because maybe we were sitting with poor posture, putting extra strain on this muscle, so it gets inflamed and irritated, and your body will put scar tissue there, and it forms that big knot. or maybe you had whiplash or some type of impact or injury, that scar tissue binds that muscle up so it doesn't get proper movement and doesn't get proper function. Now here's the key. If you massage it, if you put your thumb on it or rub it and massage it, you can break down those scar tissue adhesions. You can restore proper motion back and function, because every time you're sitting there massaging that, you're breaking up the adhesions. That knot gets smaller and smaller and smaller. Eventually it can go away and the muscle feels better and it moves better. So think about that scar tissue forming right along your spine, especially up here in the upper part of the neck, especially during the birth process, right along the spine. If you have trauma from the birth or in uterine constraint where the baby's in an awkward position, that causes inflammation, irritation in that area, your body puts scar tissue adhesions in the joints. Think of scar tissue adhesions like a cast that immobilizes that area. It locks down that joint so you don't have proper movement and motion. And remember, if you're not getting proper movement and motion, you're losing out on mechanoreception. So the brain is losing out from that area, wherever you have that scar tissue, it's losing out on that stimulation that your brain needs to function. Now, when you go back to this, 65% of neural development occurs in the first year of life. So babies, when they first come out, infants, their head, a lot of times their head's bobbly. Well, my goodness, that's getting so much movement. Remember, the mechanoreception at the top of your base of your skull, top of your neck, is more than any part of your body. That's driving proper brain function. It's developing their brain. A lot of people have heard how when kids go throughout their development, it's very important for them to go into the crawling phase and not skip crawling, going straight to walking. Crawling is something called cross-crawl patterning. That crawling simulates tons of mechanoreception up to their brain, and it develops a solid foundation in their brain that they can then put learning, speech, memory, all these other things on top of that. But you have to have that solid foundation. I once had a child that came into the office that he was 2 years old. He skipped crawling, completely skipped crawling. And the symptoms he had is he'd start running, but every time he'd start running, he would fall and smack straight on his face. He'd just start running and fall every single time. He had very little control and coordination of his body. And the other thing that he had is he had delayed speech. Now, the first thing we did, we started working with his neck. He had problems in his neck. We started adjusting very lightly, very gently, started adjusting his neck. But we also had him, every time he came into our office, we got him on all fours. I got down on all fours with him. I crawled back to the adjusting table, because that cross-crawl pattern, remember, he skipped that whole phase of crawling. We crawled back to the adjusting table. Within 1 to 2 weeks, his speech was normal and his balance and coordination was more normal. Again, neurology, movement drives proper brain function. Another thing I want to share with you, with infants, we all know about the soft spots. They have different soft spots on their head, but this one right here at the top is the one that closes up last. And that usually closes up around the age of 2 years old. But I want you to think for a second, in that first 2 years of life is the most growth of their brain. Their brain is literally growing, and it's also pruning things out, and it's growing, and it's really growing to what it's going to need as it develops throughout the rest of its life. But the first 2 years of life is absolutely essential. And when you look at the cerebral cortex, the two hemispheres up here on top of the brain, those areas, the fastest growth is going when the infant, the child goes from crawling to standing upright. At that moment, the brain, the two cerebral cortexes up top, has massive expansion to it. And then after it expands and grows, then the soft spot closes in. Because if the soft spot closed in at the age of 1 or before, that wouldn't allow for that massive expansion of the brain. But here's what's happening. When they're going from crawling to standing upright, as gravity compresses down on them, they're loading their spine under gravity. And remember, your spine has the most neurology versus any other part of your body. Any other part of your body, your spine, right along your spine. And as you load it under gravity, standing upright, that's sending a barrage of information to your cerebellum, which also grows the cerebral cortex in your brain. Then after it grows, your body will grow that soft spot. They'll start to fuse that soft spot together. That soft spot will go away in the brain. So amazing. So movement is essential. There's so much stress during the birth process. There's so much stress during the first few days of life. Every single child should be checked to make sure that everything's moving properly to help drive proper brain function. It is absolutely essential to help them establish a healthy relationship to the environment, a healthy relationship with themselves neurologically for the rest of their life. Now, all of those stresses, the physical, the chemical, emotional stresses, I mentioned that all of those stresses put what's called scar tissue adhesions, which is the knots that we feel in our muscles. But when you look at this here, the scar tissue adhesions also form all the way around the disc. The disc are the cushions between the bones. It forms all the way around that, and all the ligaments and the muscles and tendons all the way around that segment. Think of that as a cast that you put on that segment. It's literally like laying layers and layers and layers of scar tissue all on that segment, and it's like forming a cast. Like I broke my arm and I put a cast on my arm, and it's immobilizing that area. And again, we talked about it. If it's immobilizing the area, you lose that stimulation to your brain. So what I want to do is I want to pause this now, and I want to start to dive in more of this, what's actually happened. Because if you lose motion, not only do you lose that good neurology, good stimulation to your brain, but you're also going to develop osteoarthritis and degeneration throughout the joints in your spine, joints in your body, which further inhibits movement, which further inhibits the stimulation of your brain, which further inhibits your brain from being able to control your body healthy. So I hope you enjoyed this. Of course, if you have questions, that you can tell I love talking about this, let me know, ask me. I'd love to help you out with this. But I think as you know more and more about the physiology, the neurology, the anatomy, and all these things, you're going to understand better how to take care of your body for quality of life and quantity of life. So I'll see you in the next video. Have a good day, and we'll talk to you soon.